Hello, welcome back. In this session, we're going to be talking more about coronavirus specifically and disease outbreaks in general, and a little bit more about the public health response to this outbreak. So in general, diseases, viruses have been affecting human populations for our entire existence. So every so often, a huge virus will come through and wipe out a large portion of the population. Due to public health advances, in general, we have not had as many of these outbreaks lately, or we've been able to contain them much more quickly. When a new virus enters the human population, the initial phase of kind of discovering that virus can be a little bit confusing, and it takes the healthcare system a while to basically understand that this is something new and to develop treatments or vaccines that will protect against the virus. Before we have those measures of treatment and vaccine, we need to use public health measures to take a systemic approach to stopping the spread of disease. So public health measures basically include everything that is non-clinical. So instead of what happens in the doctor's office, again, we're focused on what happens outside the doctor's office. So we can encourage people to compassionately retreat from one another, to spend time just with their immediate families, to stay home more often, because that limits the amount of contact that people are having and limits the virus's ability to jump from person to person. So you've probably heard the term flattening the curve, and I'm going to link to a Washington Post article that has a really good simulation of kind of how diseases spread and what flattening the curve means. But basically, if you contract COVID-19 and you're in contact with 5 other people, and those 5 other people get COVID-19, and then those 5 other people have 5 other people, and now we have an exponential spread of the virus. What we're trying to do with these social distancing measures, like going to the grocery store a little bit less frequently and staying home more, is we're trying to lower that exponential growth so that the people that you're coming into contact with are fewer and the disease spreads more slowly. There are several reasons that this works and is really important. One of them is to protect healthcare workers. So healthcare workers still need to go into work. Healthcare workers are often working with limited supplies, and they need to make sure that they have the supplies they need to help people recover from COVID-19. So the less we can overwhelm the healthcare system, the better. So the slower the disease spreads, the better. Another reason that it's really important to practice the social distancing measures in the case of a pandemic like this is that it's really our best way of immediately protecting the most vulnerable in our population. And this is where public health kind of crosses lines with a lot of our humanist and religious traditions. So in public health, as I mentioned in the last video, there's a strong emphasis that all lives have equal value and everybody is important. And we are especially trying to make sure that our structures in society help protect the people who are vulnerable to illness. And we want to make sure that everybody stays healthy and safe until we can get this vaccine developed. One place this gets tricky is that when we use these social distancing measures, as you have probably heard, we are also having a decrease in economic activity, which has a huge impact on people. When public health officials make a recommendation like, hey, everybody needs to stay home, they are trying to save lives in the immediate term. They are aware that this is going to have economic impacts, and they're always weighing those decisions. So I encourage you, as you're learning about this outbreak, to think about what you would do if you were a public health official. How would you deal with trying to protect the various stakeholders? Protecting businesses, protecting vulnerable populations, protecting the working population, protecting children. How do you weigh all of these different needs and make a recommendation that is truly going to keep everybody safe and healthy, or as many people as possible? COVID-19 is a disease outbreak in a history of many as we humans have existed. And so we have been here before. And it's important to remember that we have gotten through this type of pandemic before. We have procedures in place. Public health officials have procedures in place to help us really control this outbreak as quickly as possible. Thank you so much, and I'll see you in the next video.